Welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and I'm excited that you are here where we're looking to elevate oral health, help out patients, help out dental leaders, and I'm excited that you're here as always. Today's podcast is brought to you by Tooth Apps Connect. Interoperability, solving the dental disorder, the biggest problem in dentistry. If you want to learn more, go check out Dental Disorder at dentaldisorder.com. I'm excited that the book is out there, and I'm getting great reviews from it, and I'm just excited that it's resonating with the community. That interoperability is for the first time really becoming a topic of interest in dentistry. It's been the biggest problem in healthcare that they've been trying to address for 20 years, and they have all sorts of problems that we don't have in dentistry. So I believe we are going to have a more holistic solution over the next 12 months. Frankly, a lot less than that. You can check it out at toothapps.com. I mean, there are already massive solutions that we have so that you can take control of your data if you're a dental practice. And by the end of this year, the end of 2023, we're going to have the ability for patients to have access to their dental records for the first time, announced here for the first time just now. So lots to talk about today. I just came back from a great meeting called Dental Forum. It was in San Antonio, Texas, where it was hotter than, well, put in your cliche there, right? It was hotter than my cup of Joe. So it was very, very hot. But anywho, it was a really exciting because for the first time, this has been one of the first DSO meetings I've been to. So what was fun about this event was I got to talk to individual DSO leaders a lot, and then I did a presentation towards the end of the meeting to kind of help close things out for representing the great company Revere Partners. If you're not aware of Revere Partners, it's a venture capital fund in dentistry, led by Dr. Jeremy Carell, who's just a great person doing really cool things with Revere. And my presentation was about the state of the economy when it comes to dentistry, and I'll summarize it here. Things are going up and to the right. Things are doing very well in dentistry. It's a great time to be in dentistry. The challenges that we have are basically rising costs. However, we're doing more than ever, and we're elevating people's care more than ever. And I believe that dentistry, particularly dental technology, is I don't know of a better sector to invest in right now, my friends, than dentistry. And if you want to invest, the easiest way is to invest into a venture capital fund that focuses exclusively on dental technologies, and Revere Partners is that partner. If you want to search for the podcast that I did with Jeremy Carell, you can certainly do that, or look for, go to bryanlaskin.com and click on podcasts, and then you can search for Revere. But if you can go to reverepartnersvc.com to invest in this whole sector. A lot of dentists I talk to say that they love the technologies that they use, but they would love to invest in the companies. Well, if you want to invest in the entire sector of dental technology, if you, like me, agree that it's going up and to the right, even faster than our practices are, frankly, go check out Revere Partners. It's a great platform. But I digress. The reason why I was out in Dental Forum was representing Revere because I'm an advisor for them. And frankly, that's how I invested, because I became a fan. But I got to talk to all these DSO leaders. And some were leaders like CEOs. Some were actually not even leading the organizations. They were, maybe you'd say like middle management within a DSO that had nothing to do clinical. There was one great DSO that I met with led by two dentists. And I'm not saying any names because I don't want to, if somebody doesn't want me to talk about them being at Dental Forum, or which there's no reason why they wouldn't. I just want to be respectful of other people's privacy. So, but it was great. It was great. But very few dentists, very few clinicians, it was all business people in dentistry. And when I say that, there's probably patients listening right now. There's probably dentists for sure. There's dental team members. There's other people in dentistry that think, oh, that sounds horrible. A dental meeting where there's no clinicians and like just a bunch of business people in dentistry who are talking to each other about, frankly, sales, right? It's software companies and other technology companies talking to these DSOs, seeing if they're interested in what they have, if they can help their practices. And I got to say, I was so so inspired and heartwarmed about where this industry is going. There's this idea that group practice lowers care and that people only care about money. And that is not at all my experience. And there's no reason for people not to be talking about money the entire time at this meeting. That's, everybody's looking for ROI. Think about if you go to a trade show and you start looking at things that, if you're a dentist in your sole practice, or if you're a patient and you go and you're thinking about business, there's always a financial element to it. However, I talked to multiple leaders of DSOs who they started a new group. Maybe there was 9, 10, 50 practices, and their focus was to do it well, to provide the best quality of care. And the discussions were very much in line, what I would hope dentists talking about their practices would be. So of course there's going to be a spectrum of people who are more interested in the financials or quality of care, and everybody in between, just like individual dentists. But I think the perspective that these companies do not focus on quality of care is incorrect. I mean, and I don't say that. And if you know me, if you read my first book, The Patient First Manifesto, if you read my second book, Dental Disorder, you know that I do not pull punches. I just call balls and strikes as I see them. Obviously, I'm not always right. I can be, just like every opinion. Mine is very, very, very open to be wrong. However, I don't. I still doesn't stop me from saying it. And I think maybe I should check into that, right? But I think the idea that DSOs don't care about patient quality, are only interested in ROI globally as a group, and that group dental practices are focused only on money is not true. There are great people leading, managing across the entire spectrum from the CEO through to the clinicians that truly care fundamentally about patient care, and no different, I hope, than other practices. And at the end of the experience of producing money in these organizations, you have a patient, right, who had care delivered, and they care that that patient has the best outcome so that they refer other people and have a successful treatment. And so what do large organizations do? They ensure things like quality control that aren't in a smaller practice. And I'm not saying that smaller practices can't have quality control. I'm just saying it's really not that different. There are differences when it comes to the actual businesses themselves. And going to a dental meeting, my friends, where there's only a couple other dentists, used to feel weird to me, but it's becoming more and more commonplace. And I would say, if you are skeptical of group practices, I would go to a meeting and you are a solo dentist or you have a couple practices, mainly because I do know that a lot of solo practitioners listen to this podcast, as do a lot of leaders in dentistry. And some of those leaders are anti group practice. As we all know, they say they're fighting for the individual dentist. And I got to say, after coming back from Dental Forum and talking to at least 20 different people that represented at least 20 different DSOs, that I just, and I said it when I was there. I was inspired. My heart was warmed that I went to dental school to take care of patients, and I think that the people that I met at that meeting, I think without exception, feel the same way, that they are in this business to take care of people, and that's inspiring and it's great. And I can and I'm not saying that the vast majority of dentists that I know feel the same way. And so if you the dental forum that I was at is a little bit different because it tends to be DSOs of 5 practices or more. So these are sort of mid to large group practices of dentists, and then software vendors or other no, not really even software vendors, just vendors to the industry who are talking to them about helping, explain about their products and helping with implementation, things like that, which is interesting. It was kind of like a speed networking, and then we went to a ranch, and which was, if you know me, it was a little outside my comfort zone, but it was fun. It was a great time, and it was just fun to. I can tell that trade shows and events in dentistry aren't just coming back, but there's about a new one that I learn about every single week. So there's so many events out there. If you're looking for something experiential, like going out to a ranch, if you're looking for something that's very focused, if you're looking for to travel to exotic locations, if you want to go to a cruise or Smiles at Sea from our friend Elijah Desmond, who does a great job. I mean, there's so many events right now that I'm saying no to one almost every week, and I'm saying yes to a lot because there's just so many good events to go to and so many people to talk to. So if you want to get out there and experience trade shows, I'd recommend it. There's lists everywhere. If you want to look for a particular type of event, shoot me a note if you're in dentistry, and I can probably find one or recommend one, or at least give you my experience because I've been to a whole lot of them. If, however, you want to stay at home and learn in your PJs, right, and you have young kids and you don't want to leave them, check out upgradedental.com. We try to bring all of the education to you without you having to leave your couch in very short video format. But I want to just mention the fact today, particularly coming back from Dental Forum, that conference, and representing the great platform Revere Partners, that I feel great about the industry and the hands that we're in as we make a titanic shift from solo practice to group practice. Right now, at this moment in time, as we all know, the only thing that is sure is that things are going to change. But at this moment in time, I'm inspired by the people that I met who are running group practices, who are managing group practices, and the people that I talk to. If you're listening to this, first of all, it's nice meeting you, and then you are one of those people that I just was inspired by the fact that you're not seeing patients clinically. However, I believe that everybody that I met personally, without exception, at Dental Forum, has the patient first mentality, meaning that they're in the business that they're in to help patients. And that's what it's all about, my friends. That's why the podcast is called the Patient First Podcast. So thank you for showing up again right here on the Patient First Podcast. If you like the podcast, like, comment, subscribe. If not, let me know in the comments below. If you want to hear different types of content, shoot me a note. And I look forward to seeing you again right here on the Patient First Podcast.